All right. Good afternoon. We'll call the Wright County Health and Human Services Board meeting to order, December 12th, 2022, at 1:30. We'll start by saying the Pledge of Allegiance, please.
I pledge
allegiance to the flag
the United States of America, and to the republic for which it stands,
one
one nation, under God, indivisible, with liberty and justice for all.
All right, thanks everyone for being here today. First thing we have is the board minutes from 11:14 at 22. Is there anyone wishes to change, add, or delete anything? If not, is there a motion for the minutes?
So moved, Mr. Chair.
I'll second.
Motion made and seconded. Any discussion? Hearing none, all those in favor say aye.
Aye.
Opposed? Motion carries for the minutes. Review and approval of the agenda. Anyone have anything to add or change on the agenda?
I'll make the motion to approve today's agenda.
I'll second it.
We have a motion made and seconded. Any discussion? Hearing none, all those in favor say aye.
Aye.
Opposed? Motion carries. Consent agenda, anything to change, remove, add? I have one thing to change under letter A. I'd like to pull that for a separate vote, because I'm gonna stay consistent on the vote we had on the application process, I believe, a few months ago. And I'd like to have a motion to vote on that one separately than the rest of the consent agenda. Does anyone have anything else to?
I'll make a motion to approve the consent agenda with item A removed.
Okay,
Second.
okay, motion made and seconded. Any further discussion? If not, all those in favor say aye.
Aye.
Opposed, motion carries. So on on letter A, I'm gonna be opposed to accepting, because I was opposed to applying based on the religious reasons. And I'm not able to make a motion, I guess, unless, when I pass the gavel, is that necessary, or?
Thank you, and
No,
sometimes these are, and this is sometimes confusing, but when we came the first time, we were asking to be approved to request an allocation, which was higher than this actual allocation, and now we're here to request accepting the $884,000 for our family planning program.
Right, and my opposition again was for the contraception part of it, that my understanding was we couldn't remove part, it was all or nothing.
You
And,
can't slice and dice it.
right, yep, so we accepted that, and that's the way that was. So-
I will make a motion to approve the acceptance of the family planning grant for $884,020.
I'll second.
Okay, motion made and seconded to accept the grant. Any further discussion? Hearing none. All those in favor say aye.
Aye.
Opposed? Aye. Motion carries 4-1. Okay, consent agenda is done. All right, under regular agenda then. Well, the approve the request, is that meant to be part of consent, or it's right above regular agenda, but we're canceling the meeting for 12/27?
That's part of the consent agenda,
Okay.
so that was approved.
Okay, then regular agenda, we have a staffing announcement with the new hires.
Yes, and actually, I'll go up to the podium since our next item after that is.
It looked like you were rehearsing Christmas carols for us. Are they gonna sing Jingle Bells too, or?
Thank you, Board, and yes, we have three new HHS staff to introduce to you today. So first, I would like to introduce Maria Magyar, and she is a new eligibility specialist. This is Maria. She is on our METS team, and she started with us on October 17th. So welcome, Maria.
Hello, Maria. Thank
Welcome.
you.
All right, stand up. This is my last time of doing this.
Yeah.
Well, welcome to the Wright County. So now the question is, do you live in the Wright County?
I do not.
Oh. So where do you live?
I live in Big Lake.
Oh, really
Yep.
close. So,
You're right next door to the Wright County.
yes.
So what'd you do before you came to the Wright County?
My entire education and career has been based in hospitality and customer service. I've been a restaurant manager for Maple Grove Olive Garden. As hard as it was to leave, I'm definitely in the right place.
Good answer.
It's better hours.
Yeah.
The right answer, right?
Well, welcome.
Thank you, Maria. We also have Catherine, I should put my glasses on since I brought them. Catherine Navala, thank you, Office Tech 1. She is on our Office Tech team. Catherine, she reports to Lisa Spencer, and she started on December 1st. So welcome.
Welcome,
Any
Catherine.
questions?
You know, if you have anything to offer to the board, you have that opportunity as the chair. I'll leave it at that. But my sidekicks here might have some additional questions. I can't speak for them.
So, welcome to the Wright County. Do you live in the Wright County?
Yes, I do.
Wonderful. Where at?
Right here in Buffalo. Raised my
Ah,
kids here, they went to school here, and, yep, I've been working at the library since you were going to ask that question.
Oh,
I
that's
worked at
why
the
you look
Buffalo
familiar.
Library, so-
Okay.
Yeah, it might look familiar to some of you. I'm the
The
neighbor.
Buffalo Library?
Yes, yep.
Now, there's a famous author that sits on this board. Did you ever recommend that author to anybody that would come in?
Yes, and lots of people read her, and she's been in the library many times.
Do you know anything about the piano tuning business?
And he said to say hello to you.
Inside info, folks, but
wow.
we do our homework.
That's our side hustle. My husband tunes pianos, and I.
We do have a secondary employment process that I'm sure that your supervisor will go over with you.
Yeah, it's her husband, an emphasis on hustle with that guy, side hustle.
Yeah, that's what kind of got my hustle. Okay,
I
So,
learned that Commissioner Ketchmark plays piano.
I didn't know that either.
Look at all the
You know,
conclusions
I've
they
got a
draw.
piano that we're trying to get rid of. I'll bring it and put it out in the entryway, and then
He can pick it up.
Commissioner Ketchmark could play it in the morning.
Oh,
man.
I think he should have like some sort of like going away tune that he's gonna play
Yeah.
at the last meeting of the year.
well, it would be nice to have somebody playing piano when people came in.
It'll be lovely.
We'll have to take this to another
Thank you,
meeting, folks.
Catherine.
Hey, you brought it up.
Well, no, you jumped to conclusions.
So lastly, we have Gavin. This is Gavin Woodland. He's a new health promotion coordinator. He is on our collaborative health services team, and he started on December 5th. Welcome, Gavin.
Thank you.
Hello, Gavin.
Boy, been a long week for you already.
It's been good. I love it.
Well, welcome to working in the Wright County. Do you live in the Wright County?
I reside down south. I'm a Carver County kid.
Oh, okay. Is that where you grew up, or?
Born and raised in Waconia.
Oh, okay. It's pretty close.
So, where'd you work before you came here?
I was actually at Minnesota Department of Health, and then prior to that, I was with Mayo Clinic and the American Heart Association in their chapters in Arizona. I was there for about a decade before moving back.
Okay. You missed the cold.
We have kids now, and just being close to family was important. So
Yeah.
So, Department of Health, we had somebody else here that used to work there and realized that they were better off at the Wright County. So, glad that you made that right choice.
yes, the state has its purpose, and I will be continuing relationships with them. But I just love local jurisdiction, and so that's why I'm
It's a
here.
very diplomatic answer. Gavin is our new environmental services. So, board, you remember all the discussions we had around environmental services, what that would look like. And so Gavin is our new addition that will be taking over the environmental services aspect of public health.
Gavin's keeping his
welcome.
political options open by being very diplomatic.
Yes, he is.
Well, I was going to close and say thank you for the opportunity, but that might be a little more diplomatic. So, but thank you.
Yeah,
Thank you.
Welcome aboard.
All right.
And just for the rest of the people that are sitting around here, this is the last time you have to hear me say that sort of stuff. So, you're lucky now.
I know. You have to pass on to someone else.
Yeah, I don't know if there's anybody capable
I
of
think
it.
we will be hearing those. I think we'll be hearing those words echoing in this room for many, many, many years.
All right, next we have Employee of the Month for January of '23.
Yes, I'm going to invite Becky Waddell to join me up here at the podium. Yeah, come on, Becky. I told Becky she's lucky because January has 31 days, not a lot of holidays, and it's really cold, and she gets to park in a good spot. So, so board, our January Employee of the Month is Becky Waddell. Becky is an eligibility specialist in our Economic Engagement Coordination Operations Team, which the abbreviation is ECHO, specializing in long-term care. She joined Wright County in October of 2018. You might also recognize her. I think you've been a long-time Buffalo business person working in insurance. Her nominee described her by saying, Becky always looks put together, and I think they mean this in the working well, looks put together and professional. She also leads in a way that is kind and thoughtful. She always assumes positive intent and encourages all of us to do the same. Becky has been our rock in the ECHO unit since we recently lost so many staff. She's the only worker with experience determining eligibility for long-term care and waiver programs while the rest of us are training. If we have questions, she drops what she is doing to help and guide us through the process. Becky is great when we have basic questions or need to talk it through. She never makes us feel like we have asked a simple question that we should know. Perhaps more important is the great service she gives to our customers. It's true she's worked more hours than any other worker to get the determinations completed for our customers needing help with waiver services, nursing home costs, assisted living costs, as well as SNAP and cash assistance. She is a priceless, caring, wonderful part of the long-term care team and continues to set the standards high for herself and her team. Becky positively impacts the lives of those we serve daily. Thank you, Becky, and congratulations on being our January Employee of the Month.
Thank you.
Would you like to say anything, Becky?
I do. I want to say one thing, and that is you have a fantastic long-term care team that is training in right now. They help each other learn. They're raring to go. They want to get the work done. They're very supportive of each other and very bright. So I'm thrilled to be a part of that team.
Thanks for everything.
I totally agree with everything she said, and I think this nomination speaks to the fact that, you know, it's not okay just to like throw up our hands and say, well, we don't have enough staff or we can't do it. The people just jump in and get it done. So it might kind of hurt inside, you know, with our staff here, but I don't think our public feels like they're been kept waiting or anything like that. So you guys have done a great job staying on top of everything. It's been amazing.
Thank you. Sounds
Thank
like
you.
a job that you deserve this.
All right. Letter B, number 1, annual approval of HHS policies and procedures from Jamie.
So you should have a fairly lengthy document in your packet this time. I'm not sure if you printed it out or not, but it's in alphabetical order, so it starts with appeals. And just as a reminder, because we just do this once a year. Yes, during the course of the year, like I think in November, we had county paid burials came to board for a question because we had there was a change in the cost of that, which is a county levy decision. So that's why we brought that one. Most of our policies and procedures are internal documents. This is not indicative of all of our policies and procedures. We use these when we have something that potentially maybe has to go to fiscal and then back to social services, or we have multiple department or divisions kind of in one scenario, just to make sure that we lay out the roles and responsibilities for each person. Then a few years ago, we decided that instead of just arbitrarily and continuously updating all of our policies, we would bring them to the board in one fell swoop each December to ask for board's approval for the document in its entirety, knowing that we would have brought anything to you during the course of the year should it have an impact that would require the board's attention. So with that being said, we have a very within this document, this is the marked up document. I have it if you would like it, of the county burial. Otherwise, if you turn in your document, well, it's kind of hard to find, but the county burial's in alphabetical order. So this is just, again, a compilation of all of our existing policies and procedures. You can see on the heading when the expiration date is. Most of them we try to revisit every 2 years to make sure that we're not just letting things kind of change. Obviously, this next year with the change with centralization with our fiscal and finance people, we'll probably have quite a few changes in the upcoming year as some of these kind of expire and we rewrite them to keep them in line. We also look at these in light of what the county policies are, and so obviously the county policy trumps anything we have here. These are just policies and procedures to help us work within our own environment and make sure we have some stated expectations as far as our policies go. So I'm just asking for the board to approve in its entirety the policy and procedure manual for Health and Human Services.
I'll make a motion to approve the HHS policies and procedures.
I'll second that.
Okay, motion made and seconded to approve policies and procedures. Any further discussion? If not, all those in favor say aye.
Aye.
Opposed, motion carries. Thank you, Jamie.
Yeah, thank you.
Next presentation on integrated services from Kim and Sarah.
So we've mentioned, yep, you can approach the podium, Sarah. This is Sarah Deerhammer. She is our integrated services, I guess I'll just say lead. We've talked to the board a few times. We brought up the information that we have started a integrated services initiative in which we attempt to, instead of having somebody have to come back to the county 2 or 3 times, finding the answer to the next question, that we try to see what the needs are at the outset so we can best meet their needs and have them be self-sufficient sooner versus later. It turns out Sarah, I believe, can tell you a little bit more, but she spends a lot of her time working with housing issues, working with eviction issues, things like that. So Sarah we have other staff. She works with Stephanie, who is here, and they work with, I would say, some of our most marginalized people living in Wright County when they have a crisis. Sarah is the person that they'd likely be talking to. So she has a short presentation.
All Sarah.
So yeah, integrated services. I've been with the county since January of last year. And so we've just kind of been evolving as this goes. So what is integrated services? We're often the first point of contact for someone calling into the agency or physically coming into the agency. We have somebody that sits up at the front desk with front desk staff Monday through Thursday. We provide wraparound services to all clients, prioritizing clients with the highest needs. And then we streamline agency services with improved communication. Currently, we have 23 team members. Most of those are answering phone calls. So when somebody calls into the agency, if they push number 3, that's for new services, and then they're the first ones that they'll talk to. And then there's a team of 4 of us that take on additional duties, such as going out to houses to get information that we might need, assisting with filling out applications, housing, anything kind of like that. Scarcity, one of the biggest problems departments face is scarcity of staff and time. We provide the ability for them to send those over to our team if they need more assistance. So if they're talking to financial and there's more than just a financial hardship there, they can connect with us and we can connect them to more resources in the community and in the county. And then we can tell them how to apply for those and assist with that application. Phones from January to November, the team has handled roughly 7,686 calls. We make sure that they get to the right department without getting transferred several times. Inform of other programs that are available to the agency and in the community and how to apply for those programs. And then we kind of recognize where we need more services or where there's holes in services. Some of the areas that we've really noticed needing more assistance in is housing, transportation, domestic violence. A lot of times those all go hand in hand as well. Currently, if you go on our Health and Human Services page, there's this tab that says wondering how Wright County Health and Human Services can help you. So if somebody clicks on that, they can do a referral and come to our team and we can help through the process of figuring out what they need, what kind of assistance they need. We try to respond within 2 business days. And then we help collaborate among the county for those needing multiple services. A lot of successes, more than we can put on here. We've helped clients with housing, multiple times helping clients fill out paperwork or clarify something that might need to be turned in. Interagency, we've assisted teams who are facing staff shortages to help kind of bridge gaps where we can help out so that we can get services to clients faster. And then collaboration, making HHS a better agency in general through knowledge of other programs and real-time collaboration for somebody in crisis. Some of our current projects, we go to Fair for All. This summer I went to Cokato Corn Carnival, I believe it was called, a lot of C's there.
Yeah.
And so we've gone to libraries to sit down to help out with like the MNsure application process. Small team providing assistance for more complicated needs and problem solving. We've gone into homes. For the future, we're looking for new outreach options, visiting housing communities to provide resources and assist with applications, especially those that might be facing eviction, because it's very hard to rent once you get an eviction on there. filling resource gaps, and then hopefully developing a larger team as the program grows. And that's it, a speed shot of integrated services.
Stay there for a second, Sarah. So I do
Yes.
want to say a few things. So none of the programs have changed. This is really more of the navigation service about how you interact with Health and Human Services. I think we've been, and I would say rightfully so, been accused of being kind of siloed. If you come in looking for food support, we wouldn't necessarily ask you if you have, employment issues or whatever the other issues are. So this is kind of nice. The eligibility for all the programs are the same, but this is how we can better assist people instead of, again, having to come back or call and get the, different information. I would also say that I think all of our staff are very passionate about what they do. This group, Sarah in particular, along with Stephanie and the main core team, are just very passionate about not leaving anyone behind in our community. Making sure that people have what they need and whatever we can do to assist them to get to that point. So I think it's been really good. And honestly, I think for the county, it's really good because I think we use fewer resources meeting more needs than when they have to come back through our doors, like just that revolving door of coming back the next time and the next time. If we can get them what they need at the outset and then they're more self-sufficient sooner and have what they need faster. So I think it's been a really successful. We're having a hard time measuring what that looks like, but I think you've done a nice job with this presentation.
I think it's wonderful that we're being proactive instead of reactive,
Yep.
which in the long run will help the constituents and people in our county.
So when Sarah said there's 23 people on the team, they're actually people that are on their own teams, but they also serve on the integrated services teams. So they might have a half day every week that they're on rotation to take the phones. And we can only do this because we went to that contact center where our staff can receive calls, so we can navigate through that process a lot easier. So anything else from anybody on the integrated services team?
Thank you, Sarah. So I have one thing. Early on, you said that this phone is staffed Monday through Thursday. So on Friday, besides we can wear jeans, what happens on
No,
with
just the
phone?
front desk. So just our presence at the front desk.
So
we
what
looked
happens
at-
on Friday with the front desk?
Sure. Well, so we went and looked at when the busiest times are at the front desk, and it's typically Monday through Wednesday, 10 to 12:30 a.m. is when most people are coming in agency. So we just went out to Thursday. So Friday is typically not as busy, but we could just add another person up
We're
there at
still
that
here and they can just contact, they would just either call up, who can come, somebody from integrated services come up and see them. So we're still serving everybody. We're not just physically sitting at the front desk on Friday.
Yeah, no, anytime somebody of the team, there's always one of us here that can go up and assist with whatever the front desk team.
So if the front desk, they come up there and they press a buzzer if nobody's there and then somebody comes, or is a phone?
No,
or-
Always have somebody at the front desk.
So we have the front desk is staffed all the
Okay.
time, all of our working hours. We also had somebody from integrated services be at the front desk so they can just hear, because a lot of times, honestly, people come in and they say, well, I need this, and then like the person on integrated services can kind of listen for, maybe some catchwords that says, well, I think we can help you with whatever, so no, Lisa makes sure that our front desk is always staffed with our folks, but integrated services doesn't necessarily have a presence there during all of our hours, just the hours that we have most people cycle through.
Okay, but you would route them then in the back room somewhere by phone if there's somebody to talk to them on Fridays?
It's even.
Or anytime during the day that we're not up there.
Oh,
So if they
okay.
come in and they're like, I need help with this application, or I'm not sure what I need help with, is usually a big trigger for us, right? Because then it's like, okay, my favorite question is, tell me more about that. Because that's when I figure out there's other services that they probably need. So front desk staff might be like, hey, can somebody from integrated services come up and do this? And then we'll go and meet with them in one of the rooms and kind of get the full story and start connecting them with resources then.
Okay, well, thank you. What comes to mind is a recent visit to a local city hall or a phone call, and you never get a live person there.
No, we are all live, and we have 29 different ways from Sunday to get a hold of somebody to come to the front desk. We have Q-Pops, and we've got
Very good.
Teams, and we've got everything.
Thanks, Sarah.
I'll have you come up if you want to, Mike, and join us for half a day.
Run me through the paces. I wouldn't mind manning a phone for a while. I'd offer to do that for Carol, but she gets scared, I think, of me coming up there. Okay, thank you. Next item is an update on immunization from Christy and Allison.
Thank you, Becky.
Oh, good, Allison's first.
No, Christie's first, actually.
darn.
Sorry. Did you all receive you have our little handout? Okay, perfect. So I'm Christy Rathman. I'm one of the public health nurses here, and I'm our immunization program coordinator and our Wellness on Wheels coordinator.
And I'm Allison Dudek, and I am the backup for both those programs.
So we just wanted to give you a quick update of what we've been up to this past year and kind of where we're going in the future. So if you're not familiar with our program, the Wellness on Wheels program offers different screening services and immunizations to community members at different parts of the county. We provide cholesterol screenings, A1C screenings, blood pressure screenings, and the majority of what we do is immunization services. So we've been really busy this past year, as you can probably imagine. So we go to the Monticello High School, the Delano Senior Center, and the Annandale City Hall. So those are where we're out in the community so people can come. We just bring all of our equipment into that location, and then residents can come in and see us and receive services. We also utilize, so we're there once a month. Then we also provide immunization services up on second floor 4 times a month at minimum. And then if we see a need for additional services, like we saw a bump in flu activity, we added a couple dates there as well. We've also utilized down here a couple times for our employee flu clinic, 1103 and 1104, as well as when our big COVID bivalent boosters were approved, we also utilized down here to get more people in and out more quickly. So we really appreciate the additional space. It's really nice to have 2 exam rooms upstairs. We can have 2 people going at a time. You can really get a lot of people in and out. And down here was great too. It was pretty seamless to get people, especially when we had that wait time for the COVID vaccine. It's nice to have them just sit and then they're on their way out. So within our immunization program, we have a few different funding sources that we use. There's a VFC program, a UUAV program, and then we also purchase some private vaccine. Our VFC program is called the Vaccines for Children program. So it's a federally funded program that's designed to provide low-cost vaccines to individuals under 19 years of age who are uninsured, underinsured on state health plans or are American Indian and Alaska Native. So we have, we ask $10 a shot for individuals if they are able, when they come see us. If they're not able to pay, we just waive the fee as a requirement of the program. We also have an adult program. It's the uninsured and underinsured adult vaccine program, which is state funded. That does the same thing, just kind of for individuals 19 and older. And that's for adults that are uninsured or underinsured. So a lot of times Medicare might not pay for certain things, and then they can come and see us if that's the case. We also have hepatitis B vaccine that we purchase. We contract with a lot of community, like fire departments, some school districts to provide hepatitis B vaccines to some of their employees. And then, of course, flu. And then COVID vaccine right now, we're still seeing a lot of people for that. That's not really funded right now. I mean, it's federally funded, so we don't have to worry about the funding source for that. I did list on there as well, just kind of an update of how many COVID vaccine doses and flu vaccine doses we've given. Obviously, our COVID in 2021 was it wasn't just our program, it was the entire division was working on that, different county agencies. Everybody was kind of all hands on deck. But as of right now, we've given 18,211 COVID vaccines, just to kind of give you an idea of where we've been kind of busy. And then this flu season so far, we've done 512 influenza vaccines, which is, we did like 400 and some last year. So we are seeing more of that as well. And then we also do a lot of community immunization clinics too. So we've gotten requests from school districts, fire departments, private businesses to provide flu vaccine and COVID boosters to their employees as well. So a lot of times we see a lot of fire departments. There was a Minnesota Visiting Nurses Association through Hennepin Healthcare used to have a team that would go out. It was very large, and they would provide vaccinations, a lot of times flu vaccines to different community organizations, and they no longer do that. So we've really seen an increase in how many requests we've had for those too. And then we've also gone to our 60 Plus and Healthy Foot clinics to kind of make sure that those elderly population is served with their flu vaccine as well. So we know that they're at increased risk for severe disease from that. Is that all?
Yep. Okay, and then to support our immunization program, we have 2 other programs. The first one is the Immunization Reminder Recall. We have a contract with the Central Region to send out letters to parents of kids who are overdue or coming due for recommended vaccinations. As you can see to the right, we did 2 different age cohorts this year, the 24 to 35 months and then the 12 years of age. You can see that each round there's less letters that we sent each time, which is good. Good to see. Obviously, we're not the only factor in them getting up to date with vaccines, but it is nice to see less letters sent. And then when parents receive these letters, they can opt out of receiving letters if they don't want to receive them anymore. They can send us updated records if they have it someplace, and then they can also make an appointment or ask any clarifying questions. We have all our contact information on there. And then we're also looking into doing text messages instead of letters, just with the way that things are going these days. So we'll see how that goes. And then our second program that we do within the immunization program is the MinVFC site visits. So like Christy explained with the MinVFC program, there's certain eligibility for people with that, and clinics are held to a certain standard and set of rules. And we have a contract with the state, who has a contract with the CDC, to do site visits to all of the clinics that have the MinVFC program to make sure that they're doing everything correctly. We discuss storage and handling, billing practices, documentation, everything like that. And we have the 33 clinics that we visit. We go to all of the clinics in Wright County, as well as Meeker, McLeod, Sibley, and Sherburne. Those counties chose not to do site visits for their own clinics, and so we took them on with a contract through the state. And so we just like to connect with these clinics to build relationships for collaboration for other projects, as well as answer any questions they might have. And I think that's all. Any questions?
No questions? Thank you, Allison and Christy.
Yeah, thank you.
Sound like you guys have been doing a lot of work.
Yeah.
Keep up the good work.
Really busy.
Next,
Yep.
we have a report back from October for a conference in Oakland, California, from Benjamin and Eleanor.
Hello, yes, I am Ellie.
I'm Ben.
And we went to Oakland in October for a final in-person meeting with a cohort we've been part of since January of this year.
Mm-hmm. Yeah, it was good to get back together with our group, network with a lot of other people who are working in public health across the country. So being able to check in on what they've been doing lately, and as well as bring some stuff back from that group to our public health team as well. I can say that working in schools, I do a lot of group facilitation as well with students, and so being able to foster an environment with all of those students being able to contribute has been very, very helpful from that.
Yeah, it's been a great experience. This is something that Sarah was actually in one of the cohorts when she started here and encouraged us to apply for and be part of this one, and it's been a great experience.
Calling Sarah a cohort, that may be appropriate.
So, yeah, thank you for sharing that. Thank you, board, for the opportunity for them to go out to Oakland to have this experience.
Yeah.
Yes, thank you. Anything else in particular that you've been able to implement since that time to improve service or anything like that to share?
Yeah, one of the main things that the two of us are tasked with on a more day-to-day job basis is providing opportunities for our colleagues to learn about health equity, and so we've been able to kind of do copy-paste jobs of some of the things that we've learned during October and bringing them back to staff. It's a lot focused on how to build relationships with colleagues and with community members to kind of get that buy-in to make changes for health equity. And so a lot of what we've brought back is kind of that relationship development with the health equity core in mind. So we have a few different initiatives that go on kind of year round, and this information has kind of helped us support the continuation of those. And we just did a big action planning last week for this next year, and so we're excited to have the opportunity to kind of bring even few more things back.
Okay, thank you.
Yeah, thanks for going.
Thank you.
All right, next is director's comments.
Yes, I have some good news and some bad news. So you should have, the good news is you should have the handout about the, I thought this was just really interesting. That they have actually scheduled more than 2,000, no, they've scheduled more than 2,000 patient visits. No, they've actually had more than 2,000 patient visits, it looks like. And you can see overwhelmingly the people that are using the dental clinic are from Wright County. There is obviously a pretty significant draw from other counties that are around our area. A couple of the things during the meeting, I'm in a dental access meeting with some of these folks, and one of the things they said is about 60% of their patients are children, so I think it's really important to have these kids getting in and seeing folks about their important dental health. And I just lost the other thing. I lost it, but anyhow, they're having really good success. They're thrilled with the response they're getting here in Wright County. And the other point was that as we expected and as they were kind of branded, almost all of their patients are on medical assistance or public assistance. So they're just seeing that same dynamic here, that the great majority of the people that they see are on public assistance. So this has been really good. And someone's going to ask me if another county has ponied up because they have people going, and no, I have not gotten any calls from any other counties ready to pony up on the cost of the unfunded cost of the clinic.
Mr. Chair.
Yes, Commissioner Wetter.
At the AMC convention, there were many people that when they saw that I was from Wright County exclaimed how wonderful we were to have made that decision to have that dental clinic there.
I think you are wonderful to have made that decision to have the dental clinic. I think this bears it out. I think it's truly a great service. Well, very needed. They will definitely be, able to be self-supporting. The other item at the meeting that I was at is that I think their goal of meeting what they needed for everything, they're short of the goal about $77,000, and I think they started out at $1 million or something. So for their internal donation raising. So.
I had a question for Commissioner Wetter. Did any of those said counties offer to write you a check for?
No.
Oh, okay, just for the record. Commissioner Hewson?
Yeah, I was surprised when I looked at the map, and it's like, it's not just regional, it's like almost statewide as far as, not many, but you get people coming from St. Louis County and Clearwater, and yeah, it's quite a spread.
Yes, it is.
Commissioner DeLayden?
Yeah, I was kind of piggyback off of that. I was surprised that Stearns and Hennepin, Hennepin has multiple places where the people can go, and Stearns has one, I believe, in St. Cloud. So.
Oh, they do have one. Okay.
I'm pretty sure they do. So it's interesting that they're pulling from those other locations. So there's got to be huge demand out there.
Mm-hmm.
So is there any other facilities north of us for those counties that are peddling down here?
Well, I don't know about facilities. I mean, they have like some of the programs like we had where they would like have the Ronald McDonald Band kind of thing come in, but that's just for kids. The ones I'm aware of are not north of where we are, but I don't know.
Yeah, a lot of them rely on a sympathetic dentist that will take MA when they get far up north. Is what a lot of them rely on is situations like that. And sometimes those can be far and few between.
Well, that's what I'm looking at, like St. Louis County is a heck of a commute, and is there any others out there that they just don't know about? Sarah?
I can just share at AMC on the last day, or on Tuesday, I presented with Blue Cross Blue Shield, and the northern counties and Otter Tail were they're doing a site visit and selecting a site for a clinic, and their estimated cost is $15 million.
$15 million?
They need a standalone site.
Well,
so this is
a
deal. And I did, at Jamie's request, I shared with all of the Central Region on Friday, both the data and the funding.
I did have one director that said, we didn't send you anything, but they'll be sharing it with their commissioners.
All right. Understood.
My item that I was very sorry to relate, and if you haven't heard, but Christine Partlow will be leaving us. So she's tendered her resignation. We're going to miss her a lot, and I just wanted to let you know. So Christine will be going to Stearns County, not for any reasons that are not about Wright County. So we're in a very similar position. As you know, she lives in Bovey, Minnesota. So she's making her way, instead of moving to the Wright County, she's trying to incrementally, I think, move her way back toward Bovey.
Well, it's been good working with you in the last couple of years, and I wish you the best in your endeavors in Stearns County, Christine.
Yes, yeah, thank you for, you've done a lot, so appreciate that.
Yeah, she's whipped us into shape. You bet. Thank you. And then I'd like to invite Jill, and actually, if you want to approach the podium, Jill. So we had a personnel committee meeting this morning, and this was one item on the personnel committee, kind of our area around MnChoice, our MnChoice area, but then it felt like at the legislative meeting, we covered a lot of ground. So I did invite Jill to share her PowerPoint.
So, Mr. Chair,
Mr. Betch.
The request of today's personnel committee, I asked that we bring this topic to the meeting here to discuss the timing, urgency, and the situation at hand that we have with MnChoices and the need for staffing for it, because it's kind of at the end of its rope at this point, and maybe it didn't get quite enough light during the budget time. I know there was a lot of desire to get the levy to a point that we felt was palatable, but then there's also the fact that this year is to a point where it's out of control, where we put people at risk, we put ourselves as a county at risk, and we have to do something to address it. And for that, I'll turn it back over to you, Jill.
I think that was a perfect segue, thank you. The title of this is called Let's Be Proactive and Get Ahead of the Ball, because I think where we're at is we did have a presentation to the board back during budget time where we were requesting positions, and yes, to try to be cost friendly to the entire county, we withdrew those, but we did give an update to the board at that time and have given subsequent updates to the board about where we're at, knowing that we were heading towards a substantial waiting list. So this is just trying to get you into the kind of a quick snapshot of where we're at. And we do have a request that we brought to Personnel Committee meeting early this morning. So we are actually at like about 120 people, I would say, waiting about 9 to 10 weeks for service. And we on average get 60 new requests a month. And at this point, we do not have enough assessors to meet the demand. So not only are we out of compliance with statute, which in my opinion isn't even the bigger issue to me, I'm concerned that we are providing not as high quality service as we could be to our constituents. And those are our most vulnerable individuals. Those are our elderly, our individuals with disabilities, significant medical needs, and mental health folks. So these are our folks that are the most vulnerable in our community, and in order to qualify for MnChoice's support and waiver support, they also are typically low income. So these are the folks that we're trying desperately to keep them in their homes so that they don't have to go to assisted living, and that they don't have to go to nursing homes, that they don't have to go and put additional strain on our community services. And by keeping them in their homes with waivered services, they get to stay with their families and loved ones and in their typical communities. And actually those waiver services are not county funded, that is actually state federal funds. We are just footing the bill for the actual staff to get the MnChoice's assessments done. And that is at this time where we're struggling. I would love to get us to a place where we could have a 5-year plan. At this point, I'm only asking for 2 staff, which in all honesty is only going to be a slight Band-Aid. We really need more than that to truly get ahead of the ball. But I also wanted to make sure that our request was reasonable and something that would be palatable for the community. I think a big part of this is it gets right at our mission and vision of what we are all about as Wright County. We talk all the time about we are the Wright County, and I want to make sure that we're standing behind that in our integrity. So this goes right in line with our value streams to promote safe and healthy communities. It goes in line with our strategic imperatives for health and human services, where we want to provide great quality customer service and develop our programs accordingly. all while, of course, meeting the objective to meet county need while utilizing financial resources judiciously. Right now, we have 7 staff doing on average about 10 assessments a month, which gives us capacity, obviously, each month to do 70 assessments. When we get 60 new requests each month, and we have 100 people on the waiting list, doing the math, that really won't let us catch up until May 2024. So not May 2023, May 2024. So we would be a long way out before we actually get to being producing what I would consider the best possible service that we could be providing, because we're only able to chip away at this 10 by 10-fold each month.
Hey, Jill?
Yeah.
Why don't you share, because I think this would be a good point to share the phone call you guys had.
So right now, like I said, we have 120 people waiting, and they're waiting 2 months or more to even get in the door to reach an assessment. And actually, I'll let Jamie share. I didn't receive the phone call, Jamie did, so I'll let you share the phone call.
I had a phone call on Friday from sounded like a young woman telling me that her grandmother had just passed away. And she was very insistent that I let everyone know that needs to know, because she knows that we need the spot to do the assessment for somebody else that could then use it. So she was just very much like putting herself out there saying, my grandma passed away, make sure somebody else gets the spot, because I know you guys really are, this is a big need area. So I just thought, wow, that's pretty insightful, and in the middle of their loss that they're calling us to make sure that we don't miss out on an assessment going out to somebody that can use it.
And I think that speaks to the length of time that folks are waiting, and it goes right in line with folks coming up on the holidays. When we hit November for Thanksgiving and Christmas time, people go home with their families and they see that their loved ones aren't doing so well, and then our demand will actually go up. And then unfortunately, typically people wait till it's way too late, where they could have been calling us 6 months ago. We would have been more on track. A lot of times it's dire need by the time we get involved. So having them be another 2-month delay is really hard.
And Mr. Chair,
Yes, Commissioner Vetch.
to your May of 2024, that's with the assumption that our caseloads aren't going to grow, which they already have if you look over.
And we're only having 60 referrals a month. That stays.
Right.
So
All things staying the same.
All things staying the same,
Right.
which we have an aging population, and I don't know if you understand, or Commissioner Wood understand what drives a mid-choice assessment. A lot of it is people that outlive their money. And
Oh,
so
yeah.
you get to 90 years old, odds are most people are their cost of them living is going to outweigh what they saved for. And if you have to wait 60 days, a lot of times people are forced out of their home long before they can get the assistance to keep them in their home. And that ends up costing taxpayers even more money. So,
Mr. Chair,
Yes, Commissioner Wetter.
when my husband had broke his arm and was in the rehab at the nursing home, he was in with another guy, and they were waiting for him to go into an assisted living. He had the room already set. It was being saved for him, and it was months. And I wouldn't doubt it that he's still there waiting.
We do what we can to prioritize folks who are going to lose their homes or become homeless or have vital dire needs. But unfortunately, when we have 120 people on the waiting list, it gets very dicey of how do you then prioritize without having other people get bumped for long periods of time.
But that's, I guess, when I got introduced to the real problem that's out there.
Yep, it happens every day.
Yes.
So going to the next slide, our request is, at this point, like I said, we were at Personnel Committee this morning requesting 2 additional Min-Choices staff. And again, I realize this is outside of budget ask, but we really want to get ahead of this issue. The longer we wait, the larger the problem will grow, and the longer it'll take us to get back to where we're providing high quality service. If we had 2 new assessments, we would be then trying to tackle 30 assessments off of the waiting list each month, and that would still put us out to June 2023. But at this point, that's what our intention is and our hope is. One thing that we also wanted to share, go ahead, Josh. These 2 new assessors, if for some crazy reason, which I'm not even sure I would anticipate happening, if for some reason we got caught up and now we have 2 extra assessors, remember how this process goes is once people come in through an initial assessment, they then typically end up on a waiver caseload. which, as you know from all my other presentations, our caseloads are way too high. And then also they need a reassessment annually. So these two assessors would most likely just move to reassessors, and we would definitely have a need there because we're basically, everybody we're bringing in on an initial assessment is gonna need a reassessment the next year. So those staff obviously will be needed in one of those two areas, if not more staff in all honesty. So I'm not worried about utilization of the staff.
I did just check this morning as well, after the personnel committee meeting, because we always talk about, well, we have a lot of staff, we have a lot of vacancies, and typically at the end of the year, you know, because we're not paying everybody for every second because of the vacancies, we have our budget is higher than what our expenditures are. So I did check with Christine today, and going into December, not counting our December payroll, we have about $23 million of total payroll costs for all of our staff for the year. That's what we have budgeted. We've spent $20 million. So if I divided the $20 million by 11 months that we've had so far, subtracted that from the rest of it, and we'd still be, after paying for December, over $1 million of our budget would be unspent in the budget area. So I know it's not exactly the right argument to make, that we're paying for staff, or we're not paying for staff because they're not here. We just would like to be able to move forward, and it's not a decision we're asking for today, but we just thought with the legislative meeting and with this morning's presentation, this was an apt time, and the holiday spirit, this was an apt time to bring this forward.
So, Joe, to my understanding, if they get moved to reassessment, then they're considered wavered. They're working under waiver, so they're better funded, correct or no?
Two different things. Majority of the folks coming through an initial assessment will end up on some type of a waiver, whether that's CADI, CAC, BI, DD. And then they will have a case manager that's like their ongoing social worker. That's one team, that's in Leanne's team. We have another team of social workers who just do reassessments.
Okay, and they get the same 15,000.
Yes.
Okay.
Yep.
I want to make sure.
You got it.
So the impact is about $160,000 to take, because there'd be another $30,000 for the two that would be reimbursed from the state /
And we
federal
used to have the waiver workers do their own assessments, and that just was blowing. We weren't able to keep up with anything at that point, so that's how we divided.
And that hurts our revenue long-term, because then it eats away at our waiver billable time. So it's the whole, you rob Peter to pay Paul, you just end up hurting yourself in one of the other areas. So this is how it impacts the county levy, and as Jamie already stated, we feel like that's a reasonable amount for the greater good that it would be resolving.
Thank you, Joe. And Commissioner Vetch, you hit on a couple of the points you knew that I was going to be interested in. And Jamie, to your math point, if you're $3 million under wage budget, we can pay each of these people $1.5 million for the next
Problem
2
solved.
weeks.
Problem solved. No, what
You'll never
They're
get
not
them.
they're about
No.
1 million. Now,
right now we're $3 million ahead, but we still have December payroll. After we do our
after
December
they'll be about
payroll,
900 to 1 million, they'll be.
I did it like
In
1.1
turn-
million is where we would still be unspent in our total budget. We
Okay.
could slice and dice that down to just social services, but that's the whole HHS.
So if I have this right, it's a personnel committee meeting this morning. I didn't know this was on the agenda until later, but the two commissioners have heard this presentation 3 times now today, basically. And now the rest of us have heard it for the first time and second time, because I think some know the way the perception of what this looks like this time of the year, where we argued a budget preliminary, August, September. We're going to let the public come and argue about the budget in 2 days. And in between there is an ask for something above and beyond that would have to be amended, modified. I guess following the regular process of personnel committee meeting, this will go to the next board for review of the minutes, motion, second, discussion, recommendation, right?
Right. Yes,
Yes.
and we thought this would be a good venue, being a health and human services topic, and we wanted to illustrate the urgency of it. Being in light of, I get that you thought it could be manageable, and just what the caseload would be since July when you put your budgets together to where we are now. I will know that I've actually had people reach out to me because of like, this isn't okay. I can't wait over 2 months to get this assessment. I need funding now because they can't stay where they're at. And so that's the reason, okay, we had to have this discussion even though the timing isn't right. The proposed levy is set, so the levy can't go above 3.9. So if we're doing this, they were basically proposing that we would use turn back dollars open positions over the next year to fund these 2 spots. And it would basically go into the 2024 as a pre-approved expense in terms of adjusting the 2024 levy.
I don't have anything else. I'll just let it run its course, the regular personnel committee route.
It's so we're mostly just looking at here to get feedback on things that they can help to narrate to help you make a better decision on the 20th, because the issue is semi-urgent and it's only getting more urgent, and that's the reason we felt we didn't want this to go to the 20th to keep getting pushed out and then having to go through with a new board, having to make a whole nother educational curve, and now all of a sudden we're 6 weeks out on an issue it's only getting worse. And that's the reason we wanted to have as much of a frank conversation as we could today, to move it along as much as we possibly could, and to do whatever we need to get support here to make something happen. So.
Thank you, Jill.
Thank you for your time.
Yeah, thank you for the ear board. I appreciate it. And with that, I have no other comments other than my my true and sincere sadness at losing 3 of our great commissioners this coming, after January 1st. So I've really enjoyed working with you all. I do feel like several years ago when I came on board in this position as director, that felt like there was a real dichotomy between, even if it's perception, like staff not feeling like the board was always necessarily very supportive of what they needed to do. And I feel like that's really turned around. I feel like staff really feel like the board supports them, feels our HHS work is really important. And I think it was probably true all along, but I think whatever the juice you guys made to make this all happen, I just really appreciate it. It makes my life so much easier. But I truly appreciate all of you. And I think the buildings, the dental clinic, everything that we've been able to do, remote work over the past years has really been phenomenal. I really appreciate it. Thank you.
Yeah, thank you. Yeah.
Good job, Ray.
Well, yeah, it has been, I just think of a very productive 10 years that 2 of us have been on the board, and certainly 8 and 2, the other 2 have been on. It's, we've had some battles to get some of these projects done, but it was worth every battle we had to go through to make this happen, because people come now and say, oh my gosh, this is such a beautiful campus and it's so nice, you can walk in and you can see, this is where I need to be, and it's all laid out. And not just for the public, but for staff. We had to get you guys out of the Pomida building, and you were in there for about 15 years, longer than they...
21.
Yeah, but longer than they had said.
Oh, longer than what they anticipated. Right?
That was, and you continue to grow in staff, but to have any more space, and I think people are starting to recognize that, although, you'll always have people that think where we were was just fine. That's perception of the public, because they're not working here, and they're maybe don't have the same problems that some people do, that they have transportation problems, so they go to the Human Services Center. Oh no, you've got to be downtown, for that, and then you go downtown, and no, you need to go out and finish that at the Human Services. And a lot of those people, daily, at the front desk, I don't know how many people would end up, at the wrong building. So it's just I think a good feeling all around that we've come to where we have, and there's, this guy came on and said, we need to do something about our technology. You're in the Stone Age. It's like, okay. So, we had different priorities, and Commissioner Burrell's priority was getting, the ditches, kind of getting those shaped up, because a lot of them hadn't been touched for 100 and some years. So there is, when I think back to all the different things, I can't remember everything. Some of it's just kind of a blur, but 5 My goal was not to build 5 buildings, but that's what we did, so, and we're done now.
Our
We
goals
should be-
change over time.
Huh?
Our goals change.
We should be good for decades, not just years, we're talking decades, so the next board will have to figure out what to do with the compost facility, and that's, gonna be another building, but, they can't blame us for that. Only Derek, no.
No, they can still blame us.
Yeah, they
and
can
say,
still
"Well, we
blame
should have
us."
done it.
Of course, you weren't here for the first, building or two.
For the Justice, well, I
Well,
caught the tail end of the Justice Center.
Yep.
But
So
I wasn't here for the highway.
The highway and that remodel, and then we built the sheriff support building as part of that project, so that was 2 of the buildings, so, yeah, so you're still good. You're still good. You can take on another building.
No, I can't.
Yeah. Mark?
All right.
Ditto. No, I do want to say thank you to all of you for the job that you guys do. I mean, it's very much appreciated. I have people that I know that need your services, and they say that you guys do a great job.
Yep.
Except for Christy Rademacher. But the rest of you do a great job. I went to high school with her dad.
Oh, did you?
So
Okay.
that's why I pick on her.
Yeah, but, I mean, it's true. The greatest resource that we have are our employees.
Absolutely.
So we need to take care of you.
Yep, so we do appreciate everything you guys do and keep up the great work that
Yeah.
you do. And pass that word on to the rest of them that aren't here today.
Yes.
You guys are gonna miss us.
All right.
Oh, I am gonna miss you.
That's all we got. Everyone have a Merry Christmas. We're adjourned at 2:31.
Thanks, everybody.